So sensory impairment or sensitivities are very common in people with intellectual disability and in specific rare genetic syndromes associated with intellectual disability. An example of this is visual impairment, for example. And we know that these sensory impairments can lead to behaviours that challenge. So in the example of visual impairment, if the optic tract is unaffected along with the optical lobe, a person might press or rub their eyes because it simulates light, and this can be very rewarding to the individual. We also see that there is higher pain threshold in some rare genetic syndromes associated with intellectual disability. So, for example, in syndromes such as Smith-Magenis or Prader-Willi syndrome, altered pain threshold may mean that when people self-injure, this might not be as painful or as aversive as it would be for somebody without these rare genetic syndromes. And this might ultimately lead to more severe self-injury than we would typically observe. We also know that under responsiveness in this way can potentially lead to people placing their hands under hot taps and leading to scalding, which is something certainly to consider if a child is placing themselves in situations where they might be at risk, or if you know a child is unresponsive to sensory stimuli. These could be potential risks that might be important to consider for the future. Perhaps one of the most common areas where we see sensory sensitivities leading to behaviours that challenge is in situations where a person is over responsive to sensory stimuli. And this can mean that certain environments are particularly aversive to be in, that they are loud, they are noisy, and this is painful and difficult for the individual. This might lead to a person engaging in a behaviour that challenges because it leads them escaping from that situation or being taken out of that situation. Ultimately, this might then be very rewarding for the person simply because the aversive, painful stimuli has stopped, meaning they're more likely to engage in those sorts of behaviours that challenge in the future. And we see these types of hyper-responsivity to sound in syndromes such as Prader-Willi syndrome, Fragile X syndrome, as well in neurodevelopmental disorders such as autism. Interestingly, we also see this emerging over time in groups such as Cornelia-de-Lange syndrome and Smith-Magenis syndrome, indicating that it's really important to assess sensory sensitivities across the entire developmental age range. Typically, there'll be really clear signs that a person might have these sorts of hypersensitivities. Particularly in sound, you might see the person, as I say, try to leave a situation or covering their ears or appearing very distressed. In other forms of hyperresponsivity, it might be the stimuli might be a different modality, such as a hyper responsiveness to light, or to tactile information, such as labels in clothing, or it could be textures, such as the taste of certain foods. But importantly, it's really, where we see these multimodal types of sensory sensitivities, and it just shows that we really need to do a thorough assessment of sensory sensitivities and understand how these might interact with behaviours that challenge. There are lots of things that can be done to reduce the input from these sensory sensitivities, or to change the environment in a way that means that the environment is less aversive to the person. And it can be important to do these things early, because over time, not only do behaviours that challenge emerge, but it's also possible that a person can become very phobic of situations that are very aversive, and may start to avoid more and more situations as they develop, because of being concerned about being in these situations. There's lots of information about how to work with sensory processing difficulties and how to assess sensory processing difficulties in the Cerebra Sensory Processing Guide, which is available for download on the Cerebra website.